We see a lot of symptoms related to the lower bowels, diarrhea and constipation, abdominal pain, irregularity of defecation and things like that. And the worrying thing is looking for the serious condition, you know, the bowel cancer, because bowel cancer is very high on the list of killers in this country. And we fortunately now have a screening program that's actually already starting to show an effect in the older population.
How does that screening program work?
People are sent a letter and they're invited to provide a sample of their stools and to send it back through the post on a little card. And then if that sample has blood in it, they're then invited for further tests, which may result in them having a colonoscopy, where a flexible fibre optic is put up their bum and a surgeon has a look at their colon.
And what does bowel cancer look like when you look? I imagine that the camera inside is looking through a great big sort of pink tube, really moist pink squishy tube, which would be your bowel, I suppose. And what does the cancer look like? Cancers
look like an irregularity. The lining of the bowel is nice and smooth usually, and it's usually an irregularity with a lump growing out or an irregular lump, and sometimes it can be an ulcer, a hole in the bowel wall. And
how would somebody know that they had bowel cancer? Would they have some sorts of symptoms which they think, hang on a minute, something's not quite right here?
Well, the reason for conducting a screening program is in order to detect bowel cancer before they have symptoms, because if you detect it before you have symptoms, you can remove tumours before they've spread and thus save people's lives. By the time symptoms have developed, it may be further on down the line. Bowel cancer is curable if it's caught early enough, but the idea of screening is to catch it before they have symptoms. But the symptoms of bowel cancer might be, or would be, diarrhea is a very common symptom of bowel cancer. Persistent diarrhea that goes on for weeks on end. Sometimes with blood in it, but normally it would be altered blood, black blood, old blood. Sometimes abdominal pain, and obviously more severely when things get further on, weight loss.
Why does it grow so quickly? Why is that one of the cancers that grows so quickly? Is it because it's in that sort of moist area where there's lots of food, or?
I don't think it does particularly grow faster than other tumours. It varies in the way it grows and moves around the body, like any other cancers. I don't think it's particularly a fast growing tumour. You can have slow ones or fast ones.
Is it that it's just difficult to notice?
The symptoms of it vary in their presentation, and it depends whereabouts in the bowel the tumour is and the characteristics of the individual. But some people don't notice it until it is quite advanced, and other people notice it at a very early stage. It's luck, really.
So we've got somebody there with persistent diarrhea going on for weeks. That's going to be pretty uncomfortable and pretty horrible, but could that actually not be cancer? If there's somebody listening now and thinks, oh my goodness, I've had diarrhea for a week and I haven't been away on holiday or anything.
Yes, the commonest cause of diarrhea is still infection, and so a gastroenteritis or a foodborne infection or an airborne infection sometimes is the commonest cause of diarrhea. And the criteria that we work on in this country at the moment is 6 weeks. If diarrhea has persisted for 6 weeks, then we would start to look for causes other than infection. But I would normally say to people, if you've had diarrhea that's persisted for 1 week, you should go and see your doctor and at least get a sample tested to check that you haven't got something like salmonella that maybe needs a little bit of help to get rid of it.
I was going to say, I mean, if it has persisted for a week, there are some foodborne infections out there which are really quite serious that you need to have treatment in order to look at.
Well, the salmonella is the one that we all know about, and Campylobacter is another very common one in this country. They don't necessarily need to be treated because they can be self-limiting infections that the body will clear in their own right, but they do need to be diagnosed, and you do need to be very careful with personal hygiene. And anybody who works in the food industry who has a proven salmonella or Campylobacter or similar infection cannot work with food until they are cleared of the infection. There are severe cases, and the severe cases normally are people who are already weak due to other illness or age, and they can be helped with antibiotics. But antibiotics for diarrhea have to be used very carefully, because most antibiotics, or most broad spectrum antibiotics, have diarrhea as side effects. So the paradox is the drug that cures the diarrhea can also cause the diarrhea.
That puts you in a difficult position then, doesn't it?
It puts you in an impossible position sometimes.
If you have diarrhea and basically everything's just washing through your system, you have bacteria in your digestive tract which is useful, and some which is not so useful, which could be causing the diarrhea. Is there a way of sort of replenishing yourself with that good bacteria in order to cure yourself that way?
There are things that are marketed where you can actually take capsules that contain bacteria, or you can take active yogurts and things like that. But the truth is that after an infection, your body naturally colonizes with the right bacterial load. But it does take time, and it can take quite a few months. And it's true that every time you take antibiotics for any cause, you alter the gut flora, because as well as killing the bacteria that's causing the infection for which you took the antibiotic, it's also killing some of the good bacteria in your gut, and that takes time to readjust.